do you personally sit in on many of the consultations when a patient comes in?
Yes.
What would you say if, again, the spirit we're doing this for is for patients that are doing their homework or trying to figure out, A, if this is right for them, B, they're scared, they hate the dentist, they've been hosed, whether it's in their own mind or real in the past. This sounds highly invasive. Remove all your teeth. They're scared, right? Let's just cut to that. What would you say are some really good questions to ask of wherever you're going to go? This is to somebody in Seattle that can't come to Atlanta, right?
Sure.
Or somewhere all around the world that they can't. What would you say is are some good questions to ask during that consultation to help increase their chances of success and lifelong smile ability when they're in that consultation?
A couple of my main points would be to ask how many implants is usually the dentist would even think about planing. We would definitely not go for the All-On-4 process. We would go for the All-On-6 or 8. So if there is availability of the bone, that's one of the things. So the patient should ask the dentist how many implants do they think they can place. Is there a difference in implant types? Are these implants high quality implants, or are they very cheap implants that are made somewhere we don't know? So there's so many things we have to consider here. Sedation is a big process. They have to ask about if sedation is available and what kind of sedation does the patient want versus what kind of sedation does the dentist offer. So we have an anesthesiologist here that comes in and take care of the sedation. So we're not in control. The anesthesiologist is, which gives us the peace of mind to focus on what we do. Mm-hmm. Some dentists like to do both. Maybe they're trained for it, but it's more stress. Also, one of the questions I would ask is, the same dentist doing the surgery, is he the same one doing the prosthesis? I prefer to obviously have a surgeon that focus on surgeries, prosthodontist focused on pros, and an anesthesiologist focused on the anesthesia. And the reason is, if everybody is a specialist in their field, you'll definitely get a better quality. Not because I'm a specialist and I'm saying that. I know because as a general dentist, when I got out of school, I don't imagine myself just going to a weekend course or few months course and then, okay, I can place implants and all that. Maybe the simple ones, yes. But the more complex cases, definitely a team approach is the way to go. So I would ask, is this being done by a team? Is it an all-inclusive fee? You need to know the fee because you don't want to be surprised. You have to pay this much at one office, then go to the other office. Another really important thing is to ask if your entire treatment is done in the same office or in different offices. Because you might do the surgery in one office, then you have to travel and do the teeth in another office, which, could be a burden on some people, but sometimes it's okay. So, it's very important not to focus on Google reviews, in my opinion. I'm just being honest. Or how much does the doctor post, or how much they show themselves into a lot on their Instagram account and all that. It's really, you have to look at the quality. In my opinion.
How do you know? And I'm with you 100%. How do you know the quality as a patient?
Great question. So as a patient, you should ask the dentist if you can see actual work that they have done.
How? Like pictures of it?
Yes. Before and after photos. Look at the quality of the photos. Look at the quality of how they made the teeth. Ask what kind of zirconia they use, or at least, where is the zirconia made? Is it German-made zirconia? Is it a China-made zirconia? Is it the cheapest zirconia on the market? What's the strength of it, maybe? So these are very technical questions, maybe, but it's like going to buy a car.
Amen.
You ask, does it have airbags? How many miles per gallon does this car make? Or what kind of engine? Do I have a warranty? That's another important question.
Amen.
Is there a warranty on the prosthesis? Do I get a night guard at the end? It's a very important part as well. Every All-On-X treatment that we have in the office gets a night guard, no matter what. It's like your insurance going out of the dealership. That's your insurance to make sure your teeth don't break down in a few years. So there's a lot of questions. If I can sum it up, I would just say, ask the dentist to see actual work, not work from a magazine from another dentist. Because I have noticed in today's society, unfortunately, our office, we don't advertise much because we are word of mouth, because this office is almost 91 years old. So we're well known enough, established, that we don't have to do that. Is it good to advertise? Absolutely. But I have actually seen in social media where people actually advertise with pre-made work by someone else. And it is the world that we live in today.
Right.
So it's very important to ask, is this the work that you
How
have
do you
done?
know? Okay, so I go into a dentist's office, and all of a sudden I say, hey, let me see some before and afters. They pop out a book. It's all nice and laminated. They start flipping through. How do I know if he pulled those off the internet or he did them himself?
Video testimonials that mentions the doctor and everything. Before video that you see the actual patient before their teeth, and then after video with the same patient with the new teeth, mentioning the doctor and the place that they've had it done in.
Yeah.
I think that's definitely more proof.
It's a great idea.
There's definitely more and more dentists trying to do All-On-X treatments.
A lot more.
Yes.
That shouldn't be doing it.
Yeah, there's a lot more. And, if they want to learn how to do it, sure, go do a 15 months course or something. There is great courses out there, to teach you how to do it. But I don't think after one course, you're a master at it.
Right.
So some patients might get a break in the first few cases that the dentist is doing, because the dentist is telling them, look, it's my first case. I will give you a break, but I will have another surgeon with me, making sure everything turns out good. Things like that happen,
Sure.
and that's okay if you have another partner dentist.
That's a great point.
So, I think it's important to make sure that this dentist that you're going to has done enough cases, that they feel confident, that they don't rush you from the chair. Big no. That it's not a denture mill or an all-in-4 mill where you just go in, you meet the assistant, you only get 10-15 minutes with the dentist, and that's it. If you feel like the dentist has spent enough time with you, shown you cases, didn't rush you, I think that's a great, indicator of how well this clinic is.
Yeah.